Hey guys, Tony here. I want to record responses to your YouTube comments. I look at as many of them as I can, but don't always get a chance to respond. So now I'm going to record my responses. Let's see if I can share my screen. Here we go. And let's just start from the top. Now, forgive me if I butcher your names. I am terrible at figuring out what people's YouTube names are. But first, Kathy Clark, 3168, giving me lots of thumbs up emojis. That's awesome. Thank you, Kathy. Then we've got, oh, you're giving me a hard one here. Anyway, Ham says, good exercise. I'm 13 months, but couldn't reach 100% of flexion. So he's mentioning this related to a YouTube video I shared, a short where I show somebody kneeling on the bench. Kneeling is one of my favorite ways to improve flexion as long as your surgeon says you are allowed to kneel. Keep working on it. I'm sure you're going to get there. So Arjinder K said, Tony, thank you. I have pins and needles in my thigh after my knee replacement surgery. This is really common. If you aren't using the rolling pin to do a little self-massage, some people will find great relief with just a very gentle massage. I prefer a rolling pin better than some of the percussion massage guns, but absolutely give it a shot. And hopefully you're still working with a physical therapist who might be able to understand what that is related to. Lady Pink Bag Sect 9116. OMG, I thought it was something wrong with me. I love when people start their comments with that because I find that so many people think this is a problem that's just affecting them, when in reality, it is affecting hundreds or thousands of other individuals. So she said, I thought it was something just wrong with me. I'm just few days. I'm going to say a few days with my left leg total knee replacement. I told the nurses that my thigh is what really hurts. I have been massaging my thigh and it's gotten a lot better. Thank you so much for the information on this video. Absolutely. I get so many patients that tell me it's their thigh or their calf that's actually more painful than the knee itself. So I'm glad you found the video. I'm glad you're doing some self-massage and it will continue to get better. So Trading Rules 2228. The equipment is poorly designed. What if there's no one around? Okay, so they're talking about a bathtub lift chair that I mentioned could be used to help individuals get up off the ground after a fall. Now you're right. It is not the main intent of that piece of equipment. I think the equipment is incredibly well designed. It's not designed to get somebody up off the floor after a fall, but it is the best alternative that I have ever found in 23 years of being a physical therapist and owning a physical therapy practice. So this person goes on to say, how is she going to reach out for the buttons on the back to operate it? It's not perfect, but it is something that's better than nothing. And it really is intended for somebody who is with you, who is unable to help you get up, to get you up. But thank you for the comment. User PP2UH. So I'm on day 10 post-op. I feel strong and healthy, anxious to get back to life. That's incredible. That is amazing. Let's see. I think the reason being for my positive recovery is due to how well I prepared my body, mind, and soul. You're right. Preparation is a huge element in this. I've always exercised. I eat extremely healthy, buying and preparing my own food. That's amazing. I don't smoke, drink, or do any drugs. My attitude is quite positive in the first and foremost, and I am a devout practicing Catholic. Life is unbelievable. That's amazing. I mean, I am so happy for you. Unfortunately, not everybody is in the same boat as you, but when I hear these kinds of stories, I think it's so great that you're willing to share that. Thank you for the post. So Harry LED Lederman, Harry Lederman 1679 says, I know you can adjust the angle from underneath, talking about a cervical traction unit, so that there is more extension than flexion as a starting point for a cervical spine. Do you recommend you have more flexion as you have it set up in your video? So, Harry, for me, I do have neck issues. I have some lower cervical issues that flare up every now and then. I find that kind of a 30 to 45-degree incline is best for me. It puts me in the right amount of flexion, allows my neck to open up. There are cervical traction devices that put you into more of an extension position. And for people that feel better with that, absolutely use it. I would say that there is no one size fits all. You have to find what works best for you and just experiment. But thank you so much for the question and the comment. Let's see if we can get two more, and then we'll wrap this video up. So Colleen Smith 9551. Hi, Tony. I'm now 14 weeks after my knee replacement. My knee eventually was starting to improve, but I still find it painful getting in and out of the car and transitioning from standing to sitting. I have been increasing my exercising and walking the past 2 weeks, but now the area around my kneecap is tense and swollen again. So it's common that patients will develop either like a patellar tendonitis or increased inflammation around the knee itself when they're increasing activities. Usually, and this is my personal opinion, this isn't based on research, but usually I think what happens is patients go from like very little or no exercise around the knee to every single day, multiple times a day doing exercise. And so even without the knee surgery, if I went from a zero training program to every single day training 2 or 3 times a day, I am going to develop any kind of itis, either bursitis, tendonitis. I'm going to develop these overuse injuries that just need time to recover. So in my experience, I would tell you that either you need to look at your recovery, optimize for recovery, maybe not quite work just as much as you are. Most patients would benefit from taking 1 or 2, even 3 days off and not doing any exercise to allow the tissue to heal and recover. And then when they go back to exercise, they actually do better. The comment goes on to say, my kneecap is tender on the right side and down the right outer aspect of the knee. I don't understand why this is happening. What should I do? Thought I was improving, making progress, but now it seems like it's getting worse. I really do think it sounds like you're developing a little bit of patellar tendonitis. That is very common. I would tell you to take a little bit of time off, kind of do other things if you feel like you absolutely need to keep working out, but allow the tissue to recover. And so hopefully you give that a try and let me know how it goes. And then the last one, Shelly 9652. This looks so good. She's referring to a short video that I shared of me using a special roller to do a little rolling massage on like the lumbar paraspinals and across the gluteus medius. I'm in the midst of a sciatica flare-up 4 weeks post-op following a total knee replacement. Very common. I've got a video recorded on this channel talking about that exact situation. I had back surgery 17 years ago from prolapse and ruptured disc, and it seems like the sciatic nerve on the right side is very angry. I'm at my wit's end. I hate to say it, but I know that happens a lot. I've seen it happen a lot for other clients. Again, I think it goes along with you're moving different, you're walking different, you're doing a lot more probably than you normally do. And so the glute, the piriformis, and other contributing factors around that sciatic nerve root are working harder than they normally would. So the best advice, you're 4 weeks into it. Typically when you look at the research, 4 to 6 weeks, things kind of clear up on their own. Find a great therapist, talk to them, see if you can get some soft tissue work. There are different things you can do specifically for sciatica, but I know you will find the solution. Just don't get frustrated and don't give up.